Honorable WHO Regional Director for Europe, Dr. Kluge, dear Ministers of Health and dear friends, Mr. Plevris, and of Development and Investments, Mr. Georgiadis, and old collaborators at the Ministry of Health during the difficult times of the transformation for health and the economic crisis Greece faced. Dear friends, dear alternate Minister, Dr. Gaga, ladies and gentlemen, it is an honor and a privilege to participate in the opening of the first WHO meeting of the minds on quality of care. The COVID-19 pandemic has highlighted gaps and issues in quality of care and patient safety, as well as the need to build more resilient healthcare systems. I want to congratulate WHO Europe for organizing this initiative. This meeting will serve as a platform for discussion and sharing ideas on good practices and innovations aiming at the transformation of health systems. As Deputy Minister of Mental Health, I consider mental health care to be at the forefront of the necessary reforms and the current crisis as a unique opportunity to accelerate the implementation of changes in public health interventions. The COVID-19 pandemic and its consequences have posed a serious threat to global mental health. The individual and collective psychosocial impact could have a greater effect than the pandemic itself and can persist and last for several years after the pandemic. Therefore, high-quality, integrated, and people-centered mental health services and psychological assistance to the general population with an emphasis to the vulnerable groups is required not only during but also after the pandemic. Mental health evolves throughout the life cycle. Therefore, we as governments and society have a responsibility. We have to use the information on risk and protective factors and put in place actions to promote mental health at all stages of life. Back in July this year, at the Athens Mental Health Summit, convened by WHO Europe and hosted by the Greek government, policymakers and experts from 53 countries in the European region issued an appeal for mental health to be placed at the heart of the recovery process post-COVID-19 pandemic. An important declaration was adopted on the actions needed to overcome the effects of the pandemic on mental health and the relevant services. The declaration acted as a stepping stone for the implementation of the European Framework for Actions 2021-2025 of the WHO European Region and the WHO Pan-European Mental Health Coalition. Mental health has been placed as a top priority with regards to Greece's health agenda. Significant steps have been taken so far to elevate the status of mental health in Greece during the COVID-19 pandemic. A hotline was launched through which qualified psychologists and psychiatrists offer psychological support to the general population, confidentiality, and free of charge. The mental health annual budget was augmented by 62%. An online counseling program was launched offering psychological support to COVID-19 patients. Research was funded on the effects of burnout syndrome among health workers, as well as the effects of the pandemic on minors' internet usage. We established, through legislation, early intervention in psychosis centers and services based in the community. We operated mobile units for the psychosocial support for our fellow citizens hit by natural disasters, the recent fires in Evia and the earthquakes in Crete. We legislated counseling centers in university campuses. We issued a vacancy notice for 60 psychiatrists and child psychiatrists on public hospitals and are planning to hire almost 250 nurses specialized on the treatment of patients with mental health problems. We created also digital clinics in remote areas of Greece islands of Castellorizo and Simi to provide psychosocial support through telepsychiatry. Last but not least, we submitted a plan of proposed actions to the EU Recovery and Resilience Fund, and this plan was being authorized, and we expect to absorb over 70 million euros for mental health over the next 3 years. WHO Europe, under the leadership of the regional director, a dear friend and a great Philhellene, Dr. Hans Kluge, and the Hellenic Republic, opened the new WHO Center of Excellence for Quality of Care and Patient Safety in Athens. Greece is honored to host this center, which supports the implementation of a shared ambition to achieve the highest level of well-being, health, and health protection. It aims exactly at improving quality of care and patient safety in the post-COVID area in the WHO Europe member states, notably those around the Mediterranean basin and Southeastern Europe. At this moment, and after what our Minister Thanasis Plevris also announced, I would like to stress the close collaboration of WHO with the Ministry of Health for the further expansion of the services of the WHO Quality of Care Athens office, with the launch of the Quality of Care and Adolescents Mental Health Care Program for the next 5 years. The increasing mental health burden of children and adolescents as a threat existed, as we all know, even before the pandemic, but has been exacerbated furthermore by COVID-19. This program was inspired by the WHO European Framework for Action on Mental Health 2021-2025, and we thank Dr. Pavlos Theodorakis, WHO Senior Health Policy Advisor and a close collaborator during the difficult years of the economic crisis, and Dr. João Breda of the Athens Quality of Care Office, who pulled it off. This program ensures the quality of care for children and adolescents, focusing on good practices, innovation, leadership, and the creation of a network between the mental health professionals working in this field at a pan-European level. It is a great honor for the Greek government and also for me personally to be able to work alongside WHO Europe, especially during these unprecedented times for our humanity. This crisis should be seen as an opportunity to trigger positive changes on individuals and societies across Europe, in line with the notion of building back better, so that we emerge from this pandemic stronger and better prepared in the future. Thank you very much.